Welcome to the last module, module 7, that is myth and facts about diabetes. First myth: no one in my family has diabetes, so I won't get the disease. So, definitely, this is going to be a myth, right? Because diabetes risk is influenced by both your genetics and definitely your lifestyle factors, also play a major role. While you have a parent or a sibling with diabetes, it definitely increases your likelihood of developing this condition. Many people are there with diabetes, have like no close family members with it, right? So type 2 diabetes risk is also heightened by like factors, for example, being overweight, obese, having pre-diabetic state, uh, polycystic ovary syndrome, PCOD, and a history of gestational diabetes. So all of these can also be the causes of having diabetes. Additionally, certain ethnic groups such as Latino Americans, African Americans, and American Indians, some specific islanders, then Asian Americans are more susceptible to the to getting a risk of diabetes. Age is also again another factor, I would say, because if you are more than 45, it increases your risk of getting diabetes. However, if you are going to adopt a healthy lifestyle, you can maintain maintaining a proper weight, engaging in your regular physical activity, eating a balanced diet can actually lower the risk of type 2 diabetes. I will likely develop diabetes because I am overweight. So fact is, again, this is a myth, but fact is, it is definitely true that excess weight increases your chance of having diabetes, but there are a lot of people who are overweight or obese never develop diabetes, right? And there are people who are normal weight or like only a little bit of overweight, they do develop diabetes, right? So your best is to take steps to lower your risk by using nutritional changes in your everyday life, physical activity to lose the excess weight. Very interesting one. I eat a lot of sugar, so I am worried that I will get diabetes. Right. So eating sugar does not cause diabetes because um, the using the right amount of sugar and also the type of sugar is very important. You should definitely cut down on the sweets, sugary beverages, anything that has like simple carbs. Definitely you need to do, because it's not surprising that people get often confused about whether sugar causes diabetes, because this confusion may come from the fact that when you eat food, it is going to be converted into sugar that is nothing but glucose, right? Glucose also is called as the blood sugar, which is a source of energy for your body, right? So as you know the insulin story and everything, um, what happens in the diabetes, the body does not make enough insulin, or the body does not use insulin well, right? So as a result, because of this, the extra sugar stays in the blood, that is going to cause the blood glucose level to increase, right? So for the people who do not have diabetes, the main problem with eating a lot of sugar and drinking sugar sweetened beverages is that it can make you overweight, right? Because you're having like excess calories, and being overweight does not increase your risk for diabetes. um, like not in everybody, I would say, but definitely in few people who are already pre-diabetes and they eat like a lot of sugars can cause an increase of risk in developing diabetes in future. I have diabetes, so I can never eat any sweets. So this is again a myth. Sugars, is present everywhere. So basically the sweets that you're going to eat are full of simple sugars, right? With which is going to increase your amount of glucose in your blood like more than other foods, but they're not off limits for people with diabetes as long as you plan for them, right? It's best to always have your the sweets, different type of sweets that you eat for special occasions or as a treat. Like you can eat a small amount of sugar in place of other carbohydrates. Basically, like for example, eat a dessert maybe in the end, very minute piece of it. Like for example, you like gulab jamun, let's say. Just have, I would say, like 1 teaspoon that can make you happy also, because you've eaten your favorite sweet. and it does not increase or spike your glucose levels also, right? So which is very very important. Also, if you are on insulin, your provider may also instruct you to take higher doses than the normal when you're actually going to eat sweets. But that does not mean that you if you're gonna end up eating a lot of sweets and going on to taking up the insulin shots, because that can be very dangerous when you do that, because you never know when you can have the sugar drop, hypoglycemic condition, and that can be fatal. So please do not do any of these experiments without a physician's advice. My provider put me on insulin. This means I'm not doing a good job managing my blood sugar level. So I have heard from a lot of patients, they say that, I am on insulin. That means that I'm not taking care of my diet and I'm not doing well. My body is not able to take just the medicine, so that's why I'm on put on this injection, which is not true at all, because people with type 1 diabetes must use insulin because their body is like no longer going to produce this important hormone, right? Type 2 diabetes is progressive, which means that body makes less insulin over time. So over time, your exercise, diet changes, and oral medicines or non-insulin injectable medicines may not be enough to keep your blood sugar in control. And that is the reason that you need to use insulin to keep your blood sugar level in a healthy range. But it does not mean that you're not doing a good job in managing your blood sugar levels. I have borderline diabetes, so I don't need to worry. This is again a myth. Pre-diabetes is again a term that is used for those whose blood sugar level, um, they're not in the diabetic range, but it is too high to be called normal. Definitely, right? So pre-diabetes means that you are at a risk of developing diabetes within like 10 years, or it could be like 2 years also. That totally depends from a person to person. So you may be able to lower your blood sugar level to normal levels by lowering your body weight first thing, then exercising like 150 minutes a week. You need to please talk to your physician about the risk for diabetes and what you can do to lower your risk. So please don't take it light. If you are having a pre-diabetic condition, you can definitely reverse your your values, your blood sugar levels, if you are doing a proper diet and if you are following a good lifestyle. Another one, I can stop taking diabetes medicines once my blood sugar is under control. Right? So, some people with type 2 diabetes are able to control their blood sugar level without medicine by like losing weight or eating a healthy lifestyle, following a good lifestyle, and also like having doing like regular exercise. But diabetes is a progressive disease, and over time what happens, even if you're doing all of these to stay healthy, you definitely may need medicine to keep your blood sugar within your target range. So you should never stop taking your medicines, diabetes medicines, unless and until your physician advises you to do so. People with diabetes should not eat fruit. This is again a myth, because we saw that 15 grams of carbohydrate is present in different fruits, and how what's the portion size, that is important, right? So definitely fruit is a healthy choice, and along with the vegetables, it has that proper 9-inch plate balanced meal, right? We know that fruit is higher in natural sugars than vegetable, but it is still lower in sugar than cakes, biscuits, and sweets. So it contains other nutrients like fiber also and some minerals also, right? So if your blood glucose level is really high, it's unlikely that it's the fruit that in your diet that is the problem. You need to also look at the other sources of sugar in your diet before you cut down on the fruit. You might be eating something else, like you might be eating a lot of let's just for an example, let's say you're eating a lot of white rice in your diet, and you blame the fruit as one of the causes, but there could be some other hidden causes also. Or maybe you're in between your snacks you're having like let's say dates, and you're having the sugary foods, like for example sweets, pedas, all of these in between. These could be the cause for the glucose spike, but it's not the fruit. So people with diabetes can eat fruit, but you need to understand, you need to have that carbohydrate counting list, and the portion size is something that is very very important. You only get type 1 diabetes when you're young, definitely not. The onset of type 1 diabetes, occurs more frequently in people who are under 30 years. There is like new research which has proven that half of all the people who develop the condition are diagnosed over the age of 30, right? So again, this is again a myth. Replacing refined sugar with jaggery or honey is healthy. Both. This is again a myth, right? Both the white sugar and jaggery comes from the same source in India. That is the sugarcane, as we all know. They only differ in processing. Jaggery is unrefined while white sugar, that is a sucrose, is refined, right? So as it is unrefined, jaggery is brown and it contains like some plant products in addition to the sugar. This imparts like a different taste and reduces how sweet it feels. But it is still mostly sucrose. Jaggery is definitely mostly the sucrose. Honey again, it is an animal product. It is containing like many other nutrients for growing, the honeybee larvae than just the sugars. Yet, depending on the honey, 70 to 80% of it is glucose and fructose. Also, nowadays there is a lot of adulteration of honey which is happening, with the sucrose, which is again a major concern. So jaggery and honey contain like more than just a sugar. So that is why they are, always said that it is a healthier option. But as the harm to human, the health, like it is coming from the sugar molecule. So using these as healthier sugars is actually a mistake because all of these are the same. It's the sucrose only. So the ICMR recommendation for the sugar intake is you need to have less than 5 teaspoons of sugar per day. That includes like what you put it in your tea, coffee, desserts, and any of the sugary foods. So please make sure that you have only less than 5 teaspoons of sugar per day. Thank you for patiently listening. Meet you all in the next module.